An impactful moment I had during school as a student respiratory therapist was the other RTs and the clinical aspect that I met, especially these two super important respiratory therapists that I met in Dallas. They really gained my confidence when it came to patient care and also doing the other things that they don't really tell you about during school, such as speaking with the doctors and charting, especially with the different softwares that every hospital has. I think if you want to do something in the healthcare field, but you don't want to do nursing, respiratory is perfect. I would encourage respiratory care because I think our specialty is very important when it comes to critical patients. Also, those that are needed like to be bagged or those that need to be intubated. I think it's just an important aspect. We are the ones that are there for airway management. We are there for they're also their heart as well. So lungs and heart, as I always say, those are the two main pieces as a respiratory therapist. So an inspiring moment that I had whenever I was doing my clinical rotations, I was attending this hospital in Dallas, and there was two RTs that it was during my ICU rotation, and there was two RTs that were very like, okay, you're gonna, I'm gonna teach you how to be an RT. We're gonna make you hands on. You're gonna be charting. Like I felt like they included me in that, and I learned a lot from them too. And it made me really comfortable with the scary things. But what really inspired me to do respiratory care was my neighbor. Her name was Kathy Krog. She has cystic fibrosis, so I always saw her do her vest therapy. She was like my second mom, and watching her go through that. She also went through a double lung transplant, so I got to witness that and go through that with her. And she was just an inspiration. And I had mentioned it to my teacher in high school at the time, and she also was a respiratory therapist. And she told me, she's like, "Why don't you do respiratory? Why don't you give it a try?" And I was like, "What is respiratory?" I didn't know what it was. So she told me, she showed me all the equipment that they use, what they do, and she helped me and another teacher in high school set up my college career. And I knew I wanted to do bachelor, so that's how I got into respiratory, and I've loved it ever since. Unfortunately, Kathy Krog passed away in November of 2021 or 2022, I believe, and she just it just kind of gave me more of a drive to finish strong and help her and help other patients just like her. She she was the main inspiration of it all.